It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Good morning. Once again, our next guest, Ross Klein, physician's assistant specializing in emergency medicine from Overlake Hospital Medical Center, talking about groin strains. Not a pleasant topic for us to talk about, but, you know, it's something you got to talk about and something you guys deal with, I'm sure, at IRG.
We deal with a lot of groin strains. This is that typical overuse, this muscle tear, and it's painful. I mean, it's something you got to talk about if you ever had one.
All right, here's Ross Klein and Shannon O'Kelly.
Ross, welcome to Health Talk. How are you doing?
I'm doing well. Thanks for having me.
Well, thanks for joining us. Hey, tell us about your practice. You work at Overlake in the emergency room. Before we get started on our topic, we're going to talk about groin injuries today, but I always like to kind of find out, what is the day in the life for Ross like at Overlake ER?
Well, it's usually busy.
Yeah, there you go.
So we usually see about 110 patients a day for all the different folks. I usually work about a noon to 10 p.m. shift and work with a bunch of different doctors there, see everything and exciting new stuff every day.
How'd you get interested in ER medicine, emergency room medicine as a physician assistant?
When I started, I was actually working on an ambulance.
Okay.
And transitioned to physician assistant later on, and always missed the good stories that you get there.
Yeah, and the ERs in today's world, I mean, they're pretty active, like you were describing. They're open 24/7.
Yeah, that's how we are. We never close. That's one of the rules, actually.
Yeah. So tell us, we're going to talk about groin injuries, and let's talk about the groin muscles. And we know that in athletics, we see it a lot in professional sports, collegiate sports, and even high school sports. These darn groin muscles can be strained or stretched or irritated, and they can linger and be problematic throughout the season for some folks.
Sure can. Sometimes it's really tricky to determine just exactly what it is. There's so many different connectors in that area, so not only can you hurt just one part of it, but if the other parts aren't strong, you can end up hurting that because you're relying on them more.
Right, and the groin muscles are the muscles that are coming from inside your pelvis, and they're going down on the inside of your knee, and they're drawing your leg in, or they do what we call adduction, pull your leg in. They're big muscles, and when they're stretched or strained, it's pretty painful.
Yeah, I certainly, I've done it myself, and I don't recommend it.
Yeah, don't practice it.
If somebody's out there saying, I wonder what I could do this weekend, probably that's not the choice for them.
Yeah, a mechanism of injury is usually, it's an event, it's a traumatic event, it's usually a movement, it's a lot of times a lateral movement, but when you do this, and you strain this muscle, boy, you're going to know it.
Yeah, it's usually a breaking point. It tends to happen with the side-to-side movement. So skiers, people who ice skate, sometimes when you're going up and down hills. So those people who are running and getting that last final up the hill movement, that might be what does them in. Also, you might find that you get to a point where you're at your maximum stress, and it's that one last little thing that does it, that just sort of gets you right at the end.
That's funny you say that. Having practiced and being a physical therapist over the years, I mean, it's amazing how we see these people that are injured come in, particularly skiers. They will say, it was my last run of the day. And I always say, well, your body's talking to you.
Well, who goes on after that?
Yeah.
Why would you do that? And then, but I guess some people do, actually, which can't make it worse.
But the point you're making is that last run or that last event, when you're fatigued, and you're tired, your muscles are not going to fire, they're not going to stabilize, you're going to be more prone to injure your muscles just because they're fatigued and worn out. So those signs, if your body's tired, listen to it and stop the activity.
Yeah, and also when people don't get that stretch in, that preparatory warm stretch in, you find that the muscles are not as compliant and they won't work through that last little effort, and that's when you're going to get a tear or a rupture or something that's dangerous along those lines.
Isn't it funny how people ask, why do I have to stretch? Is it important to stretch? I mean, we know stretching is so important because what you're describing, if the muscle has some flexibility, or some elasticity in it. And when a muscle is not being used and cold, it's a little bit more, so to speak, brittle. It's going to be more prone to those strains. When it's warmed up and flexible, it's going to tolerate those stresses through it a little bit better.
Yeah, I find that mostly it's talking people through the boredom of stretching.
Right. Oh, yeah, tell me about it.
It is the season. You might want do a little Christmas carols while you're stretching yourself out. That might just work your way through it. Get yourself a stretch tape.
A stretch tape. I think you can get them at Amazon. No pun intended, or no shameless plug there.
All right, more with Ross Klein and Shannon O'Kelly on groin strains after this on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Continuing our conversation with Ross Klein and Shannon O'Kelly. The topic, groin strains.
Ross, thank you again for joining us. We're talking about groin strains or groin injuries. You've done a great job. We talked about the muscles. They're the big muscles in the inside of the leg. They adduct or pull your leg towards you. They're really important and very active in a lot of athletic events, side-to-side lateral movement, particularly susceptible to injury when we're fatigued or tired or we're not stretching out. So someone shows up in your ER as a physician assistant. You're going to do an examination. Tell us about diagnosing these groin strains and the treatment of.
Sure, it's kind of a tricky diagnosis because there's so many different aspects to what could be hurt. One of the favorite diagnoses that I read about was the athletic pubalgia, which is one of my favorite terms because it sounds like you're aggressively going through puberty.
Yeah.
But essentially what it means is that there's some vague kind of injury somewhere in the groin, and that's one of the most common areas, and that's usually diagnosed through physical examination. So when somebody's pulling their legs together and they're finding pain in certain areas, that's pretty much a gimme. You could say it's the sports hernia or the athletic pubalgia. But the tricky part of this evaluation is so many different parts that could be tricking you and fooling you into thinking that's what it is. You could be having something that's actually nerve pain coming from the back or the low sacrum or even from the hip that's tricking you into it. So these are things you all have to examine. Sometimes people will screen with a plain film x-ray. It's helpful in some instances. It can show you that there's a change in the shape of the hip that may lead somebody to have some chronic groin problems. But for the most part, it's not going to give you your diagnosis. Eventually, the diagnosis may take place as an outpatient with an MRI later on, seeing how people do after a week or two of some gentle exercise or some help from physical therapy like you to focus in on exactly where the pain is coming from.
Yeah, you're exactly right. I mean, a lot of times, this typical with a groin strain, you can pick this up a lot on History and Physical. They're going to describe what happened, and that's going to kind of focus you in on your diagnosis. And from palpation, some muscle testing, some movement, you can diagnose this. But we grade these strains usually in grade 1 through 3, with 3 being severe, 1 being very minimal. So sometimes, maybe at your point in the ER, it might be difficult to grade that because it's fairly acute.
Yeah, I find that we do less of a grading system in the emergency setting and more of a what can you do setting. So early on, sort of my expectations are low. My hope is that somebody can stand up and tolerate that, go to the bathroom, and in an emergency maybe make a sandwich.
Yeah, which is important.
Yeah, I think if they can meet sort of those goals, that's my early goal management, and then I rely on you later on to come up with a longer term plan and getting them back in health.
Well, and thank you for that. We certainly enjoy getting those type of patients because our goal as physical therapists is assess, treat, and more importantly, getting back to function. And that groin injury sometimes can linger, so you want to move it right through the continuum of rehab and not irritate and stress it out. Ross, thank you so much for your time. Enjoy your work at Overlake there.
Well, thank you very much.
You've been listening to Ross Klein, physician's assistant specializing in emergency medicine from Overlake Hospital Medical Center with Shannon O'Kelly, talking about groin strains this morning. And Shannon, when you have somebody come into the IRG office that has had something like this, you've got people that are trained to work on those. I'm sure it's more common than we might think.
Oh, absolutely, Tom. I mean, like we've talked on the show with physicians and providers, we're going to take a history and physical. We're going to develop a treatment plan, and that's what we're going to do is we're going to start some intervention to get these folks back to activity. But it starts with allowing that tissue and that big muscle, i.e. those groin muscles, to heal and prepare them for activities.
All right, we're back with our final segment after this timeout on Como.